All right, Doc, this is what a travel card looks like. When there's surgery indicated, very often it'll say red highlighted like this with a marker. It indicates where the surgical area was, but it does not indicate what type of surgery was there. So if you want to find out what it is, we open up the software that we're working with that shows all of his chief complaints, his medical history, his surgical history, and you can see right in his intake paperwork on his own writing, he had a neck surgery in July of 2017 and a back surgery of December of 2017. And you're not sure exactly what type of surgery that is at this point. You can either ask him or you can look at his x-rays, which are also located in this as well. All right, good. So also, the software is available for you to use to read patients' records, their old history, any of their last notes, any of their intake paperwork, and to review their x-rays. So you're very safe and know exactly what you're working with. You won't be using the records online here to chart notes. Just for the sake of ease, you're going to be using a piece of paper to make a note. So if you want to come a little closer, I'll show you what this paper looks like. This is a SOAP note. This is an example of subjective. This is the S part. This is the objective part. This is the assessment part. And this is the plan. All four sections need to be filled out by you. In the subjective part, you just circle the general area that they're having chief complaint with, which they will indicate on their intake form. Every office visit, they fill out their own intake form on the electric software, so you'll be able to read that. And then the objective form, you can fill out passive range of motion or active range of motion was decreased without pain in the cervical spine. Any orthopedic testing that was positive, shoulder depressors, foraminal compression, any tension in the muscle tissue. You can see P to A motion was decreased, hypertonicities in the lower cervical spine, the cervical range of motion, the thoracic range of motion, and the lumbar range of motion are here. If you just want to write that there was pain or that they were decreased, you can, using arrows or indicate with a pain or a P. Now, every one of these pieces of paper will be folded up into the travel card for the patient during their office visit, and their name, we'll write their name right here, be Jim Smith, will be labeled here from the staff. Under the plan, we can write on here that you'd like to see them one more time this week, or they're seen twice a week, or for pain as needed. Under this part here, this is essential. You need to make sure you sign your name right there. This also gives you a spot to write any further notes regarding the case. So you make sure you sign every note and that you've indicated what is going on. And during the assessment part, this indicates what we did that day. So you would say you adjusted them, a 3 to 4 region adjustment. They used traction, muscle stimulation, and maybe some stretches. If you did an exam on them, you would indicate an examination. And of course, x-rays are over here. If there was x-rays, you would do this. Okay, that would be your completed SOAP note.